I am Hunter Alkonis with Men's Health Network, and I'm here with Renee Gindi from the CDC and Center for Health Statistics. And we just finished up a congressional briefing on life expectancy and causes of death within the United States. Renee, you talked in your presentation about how in recent years, as life expectancy has gone down, there have been significant changes in causes of death. Can you explain a little bit those changes?
Sure. One of the big impacts in life expectancy and the decrease in life expectancy is that we're seeing some increases among deaths from all causes among the younger age groups, so 15 to 24-year-olds and 25 to 44-year-olds. And when we break those down, what we're seeing is that we're actually finding increases in the death rates due to homicide and suicide, unintentional injuries, as well as in some of the older age groups, cirrhosis and chronic liver disease.
Um, you talked a bit in your presentation about interpreting how overwhelming it is sometimes to see different statistics online, and sometimes they may vary, but that can be for a good reason. What are some tips you have for people who are doing research on their own, trying to know about their health and the health of their family members? What are some good tips about validating these stats that we see?
Absolutely. Those are some great questions. So the first thing that I would say about validating the health statistics is know your sources. So if you're looking at someplace like the CDC or NCHS, the National Center for Health Statistics, you have a pretty good bet that those are going to be the official statistics. Those are numbers that have been tested and validated and looked at very closely by government scientists. Another factor is that you might see something called an age-adjusted rate of a condition or a behavior or maybe of deaths overall. And what's important about age-adjusted rates is that those are just rates that are really based on comparisons. So an age-adjusted rate isn't necessarily meaningful in and of itself. It's always used to compare against maybe another group or maybe another time period. So if you're looking at an age-adjusted rate, you might want to instead look for something that might be called in the same report or website a crude rate. And a crude rate is just the number of cases of a disease or the number of people who are, let's say, smoking over the total number of population.
Yeah, I just feel like it's so important when you see these different statistics, and sometimes they vary, and it's good to know the reasons why. Lastly, before you go, from your presentation, what was probably the biggest takeaway from Men's Health that's impacting our communities right now?
I think the biggest takeaway for Men's Health is really the decrease in life expectancy that we're seeing and the fact that it's sustained. So since 2014, we've seen sustained decreases in life expectancy among men, and that when we break it down into different races and groups by ethnicity, we're actually seeing those decreases across all of those groups.
Thank you so much. We really appreciate you here today sharing that information so we can make some solutions and go forward. Thank you.